Right now, across the United States, there seems to be a opioid epidemic raging across the states. States such as California have seen very, very strong implications of this pandemic. An organization called Call Matters has shown data showing that over the past 3 years, opioid related deaths and overdoses have spiked 121%, most of which have been linked to fentanyl. Fentanyl is on the rise and is causing a wave of horrible, horrible deaths across the states. What should the question for today is, what should the United States do to combat this wave of destruction? First of all, we should answer what fentanyl is. Fentanyl is a synthetic opioid drug that is used for pain relief and aesthetic, and it's 80 to 100 times more stronger than morphine, which morphine is a very strong and deadly drug in general. So very small dosages of fentanyl can be deadly. Over the past year, the United States has tried to combat this, as a lot of the fentanyl intake is taken accidentally through drugs such as heroin, cocaine, and drugs and pills that are counterfeit. They weren't made from the government. However, some of the fentanyl use is used on purpose and with purpose. To combat this, the United States last week placed sanctions and other guidelines on sanctions on China and other in Canada, trying to prevent the import of fentanyl. However, it doesn't seem to do the job. I think the first few things that should be done, firstly, is the education and promotion of awareness for fentanyl use. Because before researching for this paper and the speech, I didn't really know what fentanyl was until I did more research and found out what it really is and how deadly it can really be. Educational programs and awareness around the subject can really have a great implication for this cause. Secondly, we must address the prescription of opioids, such as, for example, if one was taken to the hospital, they're put on opioid drugs to help with the pain relief if they go through like surgery or other types of medical procedures. However, after their treatment is over, some of these patients tend to go back to the opioids and become addicted. So having awareness for that and just understanding what these people are going through can really help out. Third is is reducing harm. So using promoting drugs that counter the overdose of fentanyl, such as a drug called naloxone, could really help out with this. Help out with someone overdosing, so they won't die and they could keep living their lives and potentially overcome the addiction, or provide clean needles for these people to use and overcome their addiction, so they won't be spreading diseases how normal rusty and overused needles can be. Fourth, we should enforce more law to disrupt the flow of fentanyl to the United States. As like I previously said, China and Canada are some big imports that are promoting this increase in fentanyl, and having more law enforcement to keep an eye on different drugs coming in and out of the states would be really crucial. Fifth is treatment and rehabilitation, and just not stigmatizing, oh, he's going to rehab, maybe he has all these issues, this and that, but rather to have society see it as he's trying to get himself better and overcome this addiction that has been plaguing his life. And other treatment centers that could be placed throughout the United States to have more easy access and make them cheaper, so these people that probably spend most of their money on trying to intake these drugs, given the opportunity to overcome it and really overcome the addiction. And sixth and finally is mental health. Mental health could be a really crucial part in overcoming this pandemic, because most people that are taking fentanyl and other opioid drugs in general are facing mental health issues. No sane person with goals and aspirations really wants to take drugs. People that are taking the drugs aren't mentally aware or mentally healthy enough to understand that they're addicted to this drug and they need it to survive. So really helping out with that mental aspect and helping those people that are struggling just really understand that they're addicted. So in conclusion, reducing the fentanyl in the United States comes with rehabilitation, law enforcement, destigmatizing the rehab and treatment centers. What else was there? Education, prevention, and other self-harm. And together as a society, we can overcome this horrible